Ladies and gentlemen, the President of the United States.
Thank you all. Thank you very much. Thank you. Please be seated. Thank you for coming. Thanks for the warm welcome. We got some work to do. Thanks for being here today, and I want to thank our panelists for joining Secretary Leavitt and me to talk about health care. And before we do, I want to say a couple of words about some of the guests here. First, I'm real proud to be here with your governor, Tim Pawlenty. Governor, thanks for being here. Senator Norman Coleman is with us. Senator, thanks for coming. Three members of the Congress, Jim Ramstad, whose district we're in. Mark Kennedy is with us. John Klein is with us. Thanks for coming. We got members of the State House here. We got local officials. Mayor Jan Callison, the mayor of Mayor, thanks for coming. This is the 50th anniversary of Minnetonka, right? Yeah, good. Congratulations. Wait till you turn 60. Like it's not as old as it sounds. We're going to have an interesting dialogue today. I'm going to sign an executive order after a while, but I want to explain why we're signing the executive order to you. We got an interesting debate in healthcare in America, and I guess if I had to summarize how I view it, I would say there's a choice between having the government make decisions or consumers make decisions. I stand on the side of encouraging consumers. I think the most important relationship in healthcare is between the patient and the provider, the patient and the doc. And that healthcare policy, thank you. Healthcare policy ought to be aimed at bolstering the consumer, empowering individuals to be responsible for healthcare decisions. Kind of the crux about what we're talking about. Obviously, all of us are concerned about cost. I hear it a lot. We talk about, we'll hear from Jane Brown here, who helps those who need help here in your community. She says healthcare costs oftentimes make it hard for people to buy food. You talk to small business owners, and one of the big concerns they have is the cost of healthcare. That many, in order to stay in business, have to, you say to their employee, you provide for yourself. And that's troubling. It's troubling. It doesn't matter what your political party is. It's an issue that needs to be addressed. And so the fundamental question is, how do you address cost, given the philosophy that I've just described to you? And so here are some ideas I'd like to share with you. One way to help small businesses address the cost of rising insurance is to allow them to pool risk across jurisdictional boundaries. In other words, if you're a restaurant in Minnesota and you're a restaurant in Texas, you ought to be allowed to pool your employees into a employee risk pool so that the insurance is lower because of the spreading of risk. Those are called association health plans. One idea that says basically the small business owner will be in charge of the health care for his or her company is to encourage association health plans. Another idea is to make sure that, let me take a step back. There is a very important role for the federal government in health care, and that is to provide for the elderly and the poor. One of the things that Mike and I have worked on, and I hope some of you have helped with, is to encourage seniors to take a look at the new Medicare drug benefit. I was very concerned that Medicare had grown stale and it needed to be reformed. Medicare is a vital program, and it's an important federal program, and it worked. The problem is medicine had changed and Medicare hadn't. Medicare would pay, hundreds of $1,000s for an operation, but not a dime for the prescription drugs that would prevent the operation from being needed in the first place. And it didn't make any sense. It didn't make any sense to the seniors, nor did it make any sense to the taxpayers. So we've changed Medicare. And if you're a poor senior in America, the government's going to really help you with prescription drugs. And if you're, not a poor senior, you'll save a half on your prescription drugs. It's a good deal. Federal government's also got a role in helping the poor through Medicaid. And one of the tasks that I've given to Michael Levitt is to say to the governors, you should have the flexibility necessary to design a Medicaid program that meets the needs of your citizens. Now, having said that, here's what we need to continue doing in the private sector. One of the problems to make sure health care is affordable and available is the legal system. And it's out of kilter. It's, we want everybody to have justice. But unfortunately, particularly in medicine, there are too many frivolous and junk lawsuits that are running good doctors out of practice and running up the cost of medicine. Do you realize that in order to avoid lawsuits, many doctors practice what's called defensive medicine? In other words, they prescribe medicines that may not be necessary, or procedures that may not be necessary, just in case they get hauled into the court of law. As a matter of fact, it's estimated that the defensive practice of medicine costs your federal government, costs you, the taxpayer, $28 billion a year. Now, when I first went to Washington, I said, well, this is an issue that ought to be solved at the state level, until I realized the budgetary impact that these lawsuits are having on you, the taxpayer. And so I went to Congress and worked with the House, and we got a good medical liability reform law out of the House. Unfortunately, it's stuck in the Senate. The trial lawyers are tough in Washington, by the way. They really don't want to see medical liability reform. But if you're interested in making sure the system works, if you want to have people to have access to affordable health care and to have doctors that are around to practice to begin with, you need to have strong medical liability reform in order to make the health care system work. Thirdly, if you ever watched how these files work in medicine, like we're going to talk to Dr. Dean here in a minute. Her penmanship is probably pretty good, but most doctors don't write too well, and yet they write a lot in files. What I'm telling you is medicine is really behind the times when it comes to information technology. And one of the things we'll talk about here is how to use information technology to wring the cost out of medicine and yet be able to deliver good quality care to our citizens. It's estimated that that we can reduce costs by 25 to 30% with the advent of what we call electric medical records. So each person has got their own electronic medical record that you've got data on. In other words, we'll be passing information from provider to provider via the internet, via new technologies, as opposed to handwritten files that are carried from one office to the other. We're going to spend some time talking about that. It is a practical way to help control medical costs, so people have got health care that's available and affordable. Fourthly, we got to make sure that we have plans that encourage consumer saving. In other words, insurance plans, products for people to be able to use in order to get health care that encourages savings. One idea is health savings accounts. These are plans where you buy a high deductible catastrophic plan, you contribute money tax-free, but you're the consumer, you're the decision maker when it comes to health care. You decide. You decide what doctor you see. Think about the system today. It's a third-party payer. How many of you, have got insurance and you never really care about the cost? Because somebody else is paying the bill, right? You don't really care about the quality because some person in an office somewhere is paying the bill on your behalf. It's called a third-party payer system. It's a prevalent system today. One of the things we're trying to encourage is the design of new opportunities for citizens to be able to get quality health care where they're in charge of the decision-making that encourages people to make rational savings. If we have more consumer involvement in health care, then it makes sense. If that's the goal, then it makes sense to make sure that consumers have got rational data from which to make choices. And that's not the case today in medicine, really, when you think about it. I don't know how many of you all have ever said, gosh, I wonder how much this procedure is going to cost me, or before I go to see this person, I want to know how much it costs, or maybe I need to know what this hospital charges. I doubt many of you have done that. I think the new trend in medicine is going to be to encourage transparency in pricing, as well as transparency and quality. And that's the subject of today's discussion. How do we encourage consumerism? And what do you do? Well, one thing you do is you make sure people understand their options, how much something costs. And if they decide to make a purchase, what do they expect? What are the expectations from the consumer? Federal government has got a lot to do with this because we spend a lot of money in health care. When you really think about it, Medicaid, Medicare, Veterans Benefits, Department of Defense. And one of the initiatives Mike is now going to undertake is to say, in order to do business with the federal government, you've got to show us your prices. You got to help us develop a qualitative standard so the people that we're trying to help know what they're getting. And so here are some practical ways to address the rising cost of medicine. These are ways that basically says we want you, the consumer, in charge, that there is such thing as a market and that markets function. Remember LASIK surgery, eye surgery? It's a place where it was a procedure that cost a lot of money when it first came on. And yet there was quite a bit of competition. People said, look, I'm good at this. Why don't you come to my shop? Or you notice docs were advertising on. All of a sudden the cost of laser surgery has dropped precipitously. It's now an affordable procedure. Markets work when consumers have got options to make in the marketplace. And that's what this executive order is going to do. I'm going to have Mike describe the executive order to you here in a minute. But it's an order that basically commits the federal government to work with state and local and docs and hospitals to lead the way, to be a part of this new movement about transparency and pricing and quality. Have I done it all right?
You've done a good job, Mr. President.
That's what he's supposed to say.
Mr. President, the executive order that you will sign soon will take a big step toward developing an interoperable system of value-based competition. Now, when I talk about interoperability, you've described it. A lot of people go to the doctor's office and they have to fill out the medical clipboard every time they go. Well, this is the information age. There's no reason for us to have 85% of the electronic of the records not electronic. They're paper.
Yeah.
And this
there's a lot of savings, by the way, when you're not writing things down on paper. Just ask some of the more modern businesses here in Minnesota, where your unemployment rate is like really low because of the productivity of your companies. One reason why is they've used information technology. Sorry, Secretary.
This will move us a big step forward because it's going to say basically if you're going to do business with the federal government or large employers who are joining with us and unions and states and so forth like the state of Minnesota, you'll use these electronic standards to be able to allow for the interchangeability, the interoperability of records. Another change it will make is that, frankly, very few of us have a clue what we pay for health care. But if consumers have more information, it allows them to make better decisions about their care, not just the cost, but the quality. There's some great things happening here in the state of Minnesota where they're learning through an initiative they have here to define what quality is and then to be able to give consumers information about it so they can make a decision based on the cost and the quality. That's value. Cost and quality equals value. And if we have competition based on value, everybody wins. Based on this executive order, good things will happen. Consumers will have access to better information and better decisions. In the future, when a person is going to have a medical procedure, they'll be able to get a list of doctors and hospitals, and they'll be able to not only know where they live, where they work, but they'll be able to say, here's how many procedures like this they have done. This is the quality of the work they have done based on a national standard. They'll be able to get a sense of what the price has been. That's much different than today when people simply feel like it's impolite to ask about the quality and they don't really have a reason to ask about the cost. Another thing that will begin to change is incentives that will give people a reason now to begin to look at those things. So, Mr. President, this is a very big step forward and one that will be followed not just by federal agencies but by the largest employers in the country. Many of them are anxious for this to occur. Doctors want this to occur because doctors want to know the quality of the care that they're providing. The initiative here in Minnesota, as well as all over the country, were started by doctors who wanted to provide better care for their patients and were looking for ways in which they could improve. This will allow that.
Yeah. Why don't you talk about electronic medical records? I didn't do a very good job of describing it.
But when,
I'll give her a stand when you come back in.
all right, got it.
So one of these days, you're going to have all your medical records on, a little key that you can then plug into a computer, and all of a sudden information is at the provider's fingertips, which makes the system a lot more efficient, which means less costly, but also saves on medical errors. But the problem we face is that we've got to develop a standard language. Medicine's a fairly complicated, it's got a complicated dictionary, let's put it that way. So what's the procedure on that, Mike?
There are a lot of systems in our lives that are interoperable. If you buy a cell phone and you call another cell phone that may have been manufactured by a different company, or you may have bought your service from a different company, they still work because they're interoperable. If you have a bank card and you go to an ATM, your bank card will work just about anywhere. In fact, you go anywhere in the world, you can get the currency that they're dealing in, and you can also pay for things using an interoperable system. Medical records aren't like that. First of all, most of them are on paper, as we talked about. But second of all, even when they're electronic, you can't move records from one system to the other. In the 21st century, we will now change that by creating a system of interoperable standards. So when people electronically record their records, they'll be able to transfer them in a privacy-protected way from one place to the other. Now, this will have huge implications for consumers. I talked with a woman the other day, Mr. President, who had to take a day off work to take a child to the hospital, or to the doctor. She said, I spent a half a day being a medical courier. I had to go from one office to the next, picking up big brown envelopes of tests just to deliver them to another doctor who could interpret them. She said, in the 21st century, I ought to be able to do that with a click of a mouse from one place to another. Now, this vision is much closer than you think. We're making very good progress. We've already developed standards on laboratory transfer, on prescription drug records, on secure messaging. Won't it be nice to be able to email back and forth with your doctor in a secure way, to be able to ask questions and not have to always wait for an appointment? These are the kinds of things that medical records will show. My mother went to the doctor the other day. She told me that she filled out her name, address, insurance company name, birth date, telephone number 7 different times. Now, that's not necessary.
My mother
in the
wouldn't
21st
have been
century.
so patient as your mother. Hope she's not watching. Good job, Michael. Michael Howe is an interesting character here. He is an entrepreneur who's come up with a unique idea on how to help people have affordable and available health care. Michael, did you start your deal in the garage? Are you the classic entrepreneur
No,
starting
actually,
in the garage?
I have to give credit. There were other groups. There were physicians and entrepreneurs that devised the mechanism, devised the innovation that MinuteClinic really represents.
Okay, well, tell people what MinuteClinic is.
Well,
you
MinuteClinic,
haven't heard about it.
It's
worth
an
listening
interesting innovation in healthcare delivery that really embodies and is a microcosm of all that you're talking about in terms of medical records, transparency, and quality. As way of definition, MinuteClinic establishes a small clinical facility in convenient locations for consumers, retail stores, public buildings, corporate campuses. So it allows accessibility to health care for the treatment of minor episodic acute ailments, things like strep throat, bronchitis, sinusitis, the stuff that we all know we have to handle in a family but creates the distractions that you're talking about that costs a half a day of time to take care of. This system really provides a way to solve those problems, but it's based on the electronic medical records that you're talking about. The basic premise is an electronic medical record that not only provides the data sharing that you and the Secretary addressed, but it also provides us with an opportunity to improve our quality assurance through process management. We can gather.
So, like, what's process management? Tell people.
Well, the interesting thing is you can go through, and when you do something, strep test, a strep throat test, if you do thousands of strep throat tests, you can
You got a
compare.
problem. With your thousands of strep
You do. You have a problem. But you also have an opportunity.
Yeah, right, okay.
You've got a great opportunity.
That's the spirit. Yeah. Sorry, go ahead.
No, that's all right. You have an opportunity to measure the effectiveness of one provider versus the next. You have an opportunity to measure treatment protocols. The other possibility with electronic medical records that we have is that we can embed nationally recommended best practice guidelines for each of the conditions we treat, so that we can deliver a much higher consistency and quality of the actual treatment regimens that come out of this. Transparency. In each of our clinics, we post a message board that lists the services and the prices the consumer is going to pay before they ever come in. So every price is listed and available to consumers before they start.
So do you have one in the shopping mall, for example?
Absolutely. We have one in the Eden Prairie Mall right over here in Minnesota.
Interesting.
And the idea,
person walking down there looking that says, you know, here's the if you need help, here are the costs.
That's right.
Posted right there for them to see on.
Absolutely, and to compare to where they go. It's also right-sized, and what I mean by that, it's a small facility. It's focused on a very specific scope of practice, common family ailments that some estimates are as high as 40% of the medical visits in today's society are covered by these conditions. So this is an opportunity to provide a higher quality care, transparent pricing, but also much more affordable. Our prices are 40 to 50% of what it would cost anywhere else.
And are people going?
Well, in the last 6 years, we've completed 500,000 patient visits. We've had no malpractice claims. Consumers tell us that their patient satisfaction runs between 97 and 98%. 99.6% of our patients tell us they'd use the service again, refer it to family and friend. Clearly, the providers we selected do a tremendous job of making the emotional connection that delivers the end result that we're really looking for. But in many ways, Minnesota is unique in that this environment allows those kinds of innovations. You know, we have a wonderful environment with the existing providers, the regulators, the employers, the health plans, our elected officials all have a very clear desire to use the collective intelligence to bring these innovations to lower health care, to raise the quality. Unfortunately, as we move around the country, we're running into a hodgepodge of regulations that not only add complexity, but they add cost to the delivery. And there is an opportunity to try to penetrate this, because it's really protecting the status quo of a system that we know is broken. We all recognize the healthcare system is broken, but these regulations, these attitudes have been established to protect that status quo, which only adds cost that eventually has to be borne by either the consumer or the employer. And we have to find a way, and I'm not in any way suggesting socialized medicine, but I do think there's an opportunity for standardized medicine. There is an opportunity to take on some of this and establish national standards for healthcare delivery that would facilitate these kind of innovations and lower cost alternatives.
Well, in order to have electronic medical records, there has to be a standardization of medicine to begin with. You know, it's interesting, isn't it? It's an interesting idea you had, and it's meeting a consumer need. That stands in stark contrast to the government making the decisions for you, is to make different options available to patients, and you're providing health care at a 40% or 50%.
It's half the cost.
Yeah, it's great.
Right.
Thanks for doing what you're doing.
Thank you.
And you're in other states?
Yes, we have 86 clinics across 11 states at this point. We anticipate some very significant growth over the next few years.
Yeah, you ought to.
We're going to drive it very hard.
Nothing better than being with an entrepreneur, isn't it? You know? Thanks, Michael. Marilyn, thanks for joining us.
Delighted to be here.
We're thrilled you're here. Chairman of the board, CEO of one of Minnesota's great companies, Carlson Companies. Thanks for joining us. What's on your mind?
Well, first of all, I want to say thank you. I think we've been waiting at Carlson and in this community for about 20 years to hear what we've just heard, and that is interoperability, standards, quality standards, incentives. And at Carlson, we've worked with the Business Healthcare Action Group for, I think we started almost 20 years ago now, to look at how to incentivize providers to have more transparency. We've worked on involving and engaging our employee base in various kinds of preventative activities. But recently, we've put in several innovations. One, I have to say, a Minute Clinic in our headquarters.
You say 50%, I hope?
Actually, we did the research. It looked as if a cost to us and our employee was about $40 to $50 through Minute Clinic for this certain set of services, it was like $100 in the doctor's office and dramatically more than that in the emergency room, where a lot of people end up going for that kind of care. So we took care of that group. Now we're putting in a medical record and interface through our internet, a private portal where people keep their own records. We can look at claims data. They can enter their own claims data, their immunizations, the things you used to put in the baby book, and when you transferred to another community, you tried to think, where was that stuff? Put it on your medical record in our own website, your own private website, and hopefully one day your medical record electronically will be there so that you can download it and take it with you. Our people travel all over the world. Right now we don't have interoperability. They can't take their records with them, and it's a problem for us. So we're trying to facilitate that. We have the Minute Clinic. Then we've actually been worrying about the small part of our population, actually a small percentage of our employees have chronic issues, and they cost us the most, over $10,000 a year for about maybe 5 to 10% of the employee base. And that means that they don't come to work fully productive. They aren't excited, healthy employees, which makes for better customers, obviously better customer relationships. So we've looked at those chronic diseases, and several of us in the community, several large employers, have been looking for medical measures to actually incentivize those providers, those clinics that are providing the very best outcomes. We absolutely agree with Secretary Leavitt that value is quality plus service divided by cost. And if we can give that information to our employees, we believe it's no different than buying travel from us, or a cruise, or a hotel room, or a meal at one of the TGI Fridays. The fact is, if you have excellent information about quality, about service, and about price, people make good decisions. But without any piece of that, our whole act falls on the ground. And let me tell you something.
Okay. Yes, ma'am.
Well, I just thought, in case you like hamburgers, you would like to know that at TGI Fridays, if we don't address these problems with incentives to reward people, with pay for performance, with interoperability standards, if we don't, the increase in our healthcare costs next year means we would have to sell 533,000 more hamburgers at TGI Fridays to cover the increase in our cost alone.
Yeah, this is an issue that we're focusing on the core problem, and that is we're dealing with an industry that really is not modern, that needs help in the legal profession, and that needs more consumerism. You know, you mentioned preventative health. There's nothing that will cause somebody to take good care of their body than having an insurance program that encourages savings. You make rational decisions and you exercise and you don't smoke and you watch your drinking. It's amazing how your health improves. If you walk 2 miles every day, it really makes a big difference. And if you have policies that say there's an incentive for you benefit from making that kind of rational decision, you monetarily benefit, like the health savings accounts. It helps with prevention. If people really watched what they ate, it's amazing how health care costs would also go down in America as well. Yeah, Michael.
Mr. President, this is a good thing for our health, and it's a good thing for the system. It's also an economic imperative that we do it.
Yeah.
What Mr. Carlson suggested is, I'm hearing from employers all over the country, health care is now 16% of our gross domestic product, and it's headed for 20%. And there's really not a place in the economic leaderboard for a country that continues to spend more and more and more in one sector. I was looking at and it's hitting consumers. I was looking in my home state at the teachers. They got the largest increase in decades.
What is your home state?
That's Utah, by the way. And yet the teachers, many of them ended up having less take-home pay because of the cost of health care. People are desperate to have some relief here, and if they have access to information, and we can provide it in a more efficient way, they'll get relief.
Jim Chase. What do you do, Jim?
Well, Mr. President, I work with an organization here in Minnesota that's been working on many of the things that you and Secretary Leavitt have talked about, and we're quite excited to have you here today. Many people in the audience are coming from medical groups and hospitals who are involved in the work that we've been doing. And as Secretary Leavitt has said, it's really come from physicians coming together and agreeing upon what the standards of care should be. Health plans joining together to saying they shouldn't compete around the quality of care, but rather should share information so we can provide that back to the medical groups, give them a chance to see how they compare to one another, helping them to improve, and now stepping into a new world of working with consumers on how they can use the information. We began this year, as Marilyn mentioned, some work with employers locally for them to use that information and then provide rewards to the highest performing medical groups. So those groups know that they can invest what it takes to make a difference for their patients.
And so, like, what is your group? What's the name of your group?
We're called
Minnesota.
Minnesota Community Measurement.
Yeah.
We're a nonprofit that's been together for about 3 years.
Really? And so the local folks came together and said, let's give old Jim some work and figure out how to do it. Have a healthcare system that works well.
Right. My work came later, but I think what's exciting is that we're actually seeing some changes now. We're being able to measure this. We're seeing the results change, and it's very encouraging, I think, for the providers out there that's what they were in this for, was to find ways to treat their patients better. Even without a lot of consumer engagement yet, we're already seeing some significant increases. And a great example is over the 3 years that we've been measuring, the number of people in Minnesota, diabetic patients who are getting the optimal care, has doubled.
Yeah.
And we know that isn't just a number, that from research that means that there will be hundreds of fewer diabetic patients without the complications of heart disease, strokes, and amputations that would otherwise occur.
So, like, how many community measurement groups are there in the country, do you suspect? Sounds like it's pretty unique.
Yes, there are several though that have started. In fact, we're pleased to be working with Secretary Leavitt and the Ambulatory Quality Alliance that has formed nationally, that are bringing together to start with 6 sites around the country that are in various stages of pulling together this kind of information. It's going to be helpful for us, I think, because there are things that we do well that we can share with other sites. There are things that they do well that they can share with us. And hopefully we can also use this as a tool to help other communities that are just getting started to expand and have this kind of information available.
There are dozens of communities around the country now following the lead. Governor Pawlenty has been a real leader in being able to develop this. He has a Q-Care initiative that begins to link these together here in Minnesota. One of the reasons we wanted to come here today was because of the good things that he has done and others in developing that. But there are literally dozens of these coming, and our goal now is to
dozens
of the kind of quality initiatives that Jim has referenced. We're now moving to harmonize those into a network, again, using technology so that we can literally community to community measure quality, measure price, give people information. In the future, people will have insurance plans that will reward, as you suggested, they're making good choices, and it'll be because of the work of Jim and his colleagues and others around the country like him.
Good work, thanks. It must be exciting to be kind of on the leading edge of substantial change.
It keeps us busy.
That's good. I know the feeling. We are joined by Dr. Laura Dean, OBGYN. I will start off by telling you a startling statistic. There are 1,600 counties in the United States without an OBGYN. I mean, we're talking about availability and affordability. Obviously, 1,600 counties have got a serious problem. Thanks for hanging in there.
You're welcome.
A lot of OBGYNs are leaving the practice because they're getting sued out of existence, pure and simple. I can't put it any more plainly than that. If you want to have OBGYNs in America, we need medical liability reform to protect these good people. Step up, Doc. How long have you been practicing?
I've been practicing obstetrics and gynecology for 10 years in the community of Stillwater, and I've delivered more than 1,500 babies.
Really?
So, yes, sir.
That's good. What's on your mind?
Well, I certainly, as a physician, my goal is to help my patients make good decisions about their health care, and I'm excited about what you're here to talk about today, because I've been providing them with all kinds of medical information to help make decisions, but the financial piece has been missing, and people need that piece in order to make good and whole decisions.
So, like, are you going to put on the window, you know, Dr. Laura Dean, $100 or whatever?
Well,
how does it, are you an individual practitioner?
I'm in a group practice
Yeah.
with family practice doctors, other OBGYNs,
Good.
internists, pediatricians. So, you know, there just has not been a lot of talk about cost in medicine, but in recent years the interest has increased. I have that discussion more and more with patients as more and more patients take on financial responsibility in their health care, or as patients request tests maybe that aren't necessarily necessary or would like to follow up in a certain way, and I sit down and say, well, you know what, that's maybe not something we need to do now, may become important down the road, but that costs about so many $100s, or that might cost this, and right now it's not really necessary. And they take that information and they're glad to have that.
Yeah. See, it's interesting in a kind of a mindset change. It used to be you'd go in and just take whatever they gave you because somebody else is paying the bill. And if we can get a system down where people are able to, you know, have a good program, a good product, you know, good insurance, but where the consumer has more to say with what's purchased or not, all of a sudden the dynamic begins to change. And costs begin to go down. The good doc here, you know, volunteered to us, so you don't need this procedure. That saves money over time. The whole system benefits if we have, you know, 1,000 providers making that same decision on an hourly basis. And so what Laura's saying is if consumers have more, you know, information from which to make decisions, all of a sudden costs begin to become, you know, less of a burden on the system, I think is what you're saying.
Absolutely.
Lawsuits bothering you? No, obviously, look, I mean, I led the witness. Not even a lawyer, not led the witness.
Certainly, it is something looming over the heads of physicians every day. The thought about lawsuits, really maybe ordering tests to protect yourself and to make sure. I have many colleagues similar in age to me, which is not real old yet in practice of medicine, who've stopped delivering babies,
Yeah,
who've
that's a problem.
stopped
I'm telling you, we got a
performing
problem.
surgery.
It is a problem when society starts losing good souls, you know, that could otherwise be OBGYNs. It's a real problem, and we better do something about it, you know. It's one thing to have good law. We want good law. But these frivolous lawsuits are a real problem for people in Minnesota and all across the United States. It's serious business. These trial lawyers need to back off, and these politicians in the United States Senate, people like Coleman, need to step up, and he will. And he has. No, he's been strong. He's been strong on medical liability reform. I'm not trying to turn this thing into a political deal. I'm just telling you, for the sake of this country, for the sake of good medicine, we better get some good medical liability reform out of the United States Senate. Thanks, Dr. Dean.
Thank you.
Thanks for practicing. One of the wonderful things about America is our healthcare providers are fantastic people. They really are decent, honorable people who've answered a higher calling.
Thank
And we
you.
appreciate
Thank you,
work
sir.
that. Speaking about a higher calling, Jane Brown, Executive Director, Second Harvest Heartland. Has anybody ever heard of Second Harvest Heartland? Good. So you don't need to tell them what you do. Actually, you're feeding people who need help.
That's correct, sir.
Yeah. Actually, if people need, I presume it's okay for me to say, you could use some contributions?
Oh, my, yes. That's a wonderful thing for you to say. Thank you.
Seriously. I know Marilyn will help you.
Thank you for that.
She has. She has been helping, as has corporate Minnesota.
Yes. Corporate Minnesota has been very good to us, and Carl's companies are wonderful. Second Harvest Heartland is a food bank, and we have 800 agencies that get their food from us. So every little bit helps. So thank you for that.
And we were talking, actually, the reason that subject came up as I was asking her whether or not she had enough product to help people who need help, and the answer is never enough.
Never enough. No, nowhere near enough yet.
Yeah. But you've done some interesting things through healthcare in your outfit.
We have. Marilyn and I were contrasting. She's this huge company. There are 76 employees at Second Harvest Heartland, and 66 who receive their health insurance through our organization. And this last year, we offered an HSA for the first time as one of the options. And 15% or 10 of those employees opted to take it. And I am one of those who opted to take it.
Everybody understand what that is? It's, again, a high-deductible catastrophic plan, and that the person and or the company can put money in tax-free to cover up to the deductible.
That's great.
Which actually saves money.
It saves money. It does so many things, and that's why we've chosen it. But before we could choose it, we needed to know that there was information behind it, so we could make, because we are now consumers. The money that we put in, if we don't spend it, or what we don't spend, goes into a savings account. That's
tax-free.
That's tax-free, and it's portable.
Right.
That I think is very important, especially for younger workers who will be moving in their career. So that savings account will move with them, and it will be available for us when we retire, or sooner, whenever we need it, to pay for health.
And do you contribute into the savings account for your employees?
Yes. As the employer, yes, we do.
100%?
No, it's a shared responsibility.
Right.
And that's very important, that there's a shared responsibility in that. And so what's very important is that we become educated consumers, as you talked about. And so we're very fortunate. Health Partners, which is our provider, has the electronic medical records, and it has the information on cost and quality, and it's available 24/7 because we can just go online and get it, or we can call in and get that information. So let's say if I needed an MRI or a CAT scan, there's a huge difference in how much it costs depending upon where you go. Most of us don't realize that because we've never had to realize that. But believe me, if I needed one, I would check the cost, because that's going to come out of my retirement savings.
Right. Jane has given her employees a very interesting option, and that is a consumer-driven plan where there is an incentive to save, to be a good shopper, and to make rational choices about how you live your life. And, if you live a healthy lifestyle, you're going to spend less money out of the money she has contributed into their health account. If the money's yours. In other words, there's a catastrophic plan available that you may pay the first $3,000. The $3,000 is on the company, and then anything above $3,000 goes to the insurance company. So you can see, if you don't spend the $3,000 and you're able to roll it over tax-free, and then there's another $3,000 contributed next year, and you roll over money you save, pretty soon you got a good health savings account, because the government doesn't tax any of it. It doesn't tax the money going in, it doesn't tax the earnings, and it doesn't tax the money coming out. And if you change jobs, by the way, what's an interesting statistic in our society today, somebody told me the other day that people change jobs about 8 times before they're 32 years old. That wasn't the case when we were growing up.
No, it wasn't.
Yeah. Anyway, doesn't it make sense to have a plan that you can carry with you? It's called portability. And so what Jane has provided employees is something that encourages consumerism, but it also helps meet their needs. And that's what medicine's got to do. It's got to meet the needs of the consumer, not the government. And that's what we're talking about. Innovative ideas, innovative ways to help control costs in health care. And I hope you've gained something from this conversation. At the very least, please leave with the notion that we're thinking differently, because you need to think differently. The system right now needs reform. It needs to be fixed. And you're fortunate in the state of Minnesota that you've got leadership at the state and local and the corporate and individual level that is willing to think differently to help a new system evolve. And it's coming. it's going to make a huge difference for people's lives. And I want to thank all our panelists for joining us today. It's been a fascinating conversation. God bless you all. Yeah. Now, wait a minute. Now I'm going to sign an executive order. And I think you'll find this interesting. It doesn't take very long. And we usually have people stand behind me when I do it. You ready? Delaney? Done.